Hello, everyone. A very good afternoon to all of you. I'm Sayukta from Vistas Media, your host for today on Hair All Issues Resolved YouTube channel. We go through a lot of look beautiful related issues as we grow up, but little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hair, we have with us an expert dermatologist, Dr. Akshita Anand. She is live from Ghaziabad. Dr. Akshita Anand is a committed dermatologist and an aesthetic physician with a great clinical acumen and diagnostic skills. She completed her MBBS and post-graduation MD from Swami Vivekanand Subharti University and has also attained a fellowship in aesthetic medicine. She is also an accredited member of the IADVL, Indian Association of Dermatology, Venereology and Leprosy. She has over 6 years of accomplished experience in managing various skin disorders, acne, pigmentary skin disorders, hair loss, and facial aesthetic, enhancing procedures using the most advanced technology. Dr. Anand believes that our skin is one of the most amazing organs. It is intelligent, highly responsive, and is a part of the bigger picture related to our health. This was the main reason for the inception of the Skinfluence Clinic, Ghaziabad. It's such a pleasure to have you, Dr. Akshita Anand, with us. A very warm welcome to you.
Thank you so much. Thank you.
So, Dr. Akshita, today, as we are going to talk about hair loss, first of all, on daily basis, we do lose or do shed a lot of hairs. But then we are not very sure it's normal or we should be concerned about it. So in terms of hair fall or shedding of hairs, what's normal and when we need to be concerned?
So actually hair loss can be hair breakage and it can be hair fall from the root. Hair breakage happens when the hair shaft is weak. It can happen in dry, damaged hair or anything like that. But hair loss can occur from the root of the hair. Hair loss up till 50 to 100 strands per day is pretty normal and it's considered normal. It is a cyclical shedding of hair. But anything beyond that, or if there is any visible spot of baldness or any patch of baldness, then obviously we should consult a dermatologist and start treatment for it.
Okay. Now the thing is, as I just said that, we all see hair falling or hair loss is a very common issue. Now the problem is we normally don't understand why is it happening. So Dr. Akshita, what are the general causes of hair loss?
So just to name a few, they could be hair loss is multifactorial. So there can be many causes for it, starting from the basic ones like stress. Stress is a major factor for hair fall. Any kind of stress, be it be emotional or physical stress, it will lead to hair fall. Then other hormonal issues such as thyroid disorder can cause hair fall. It's a known cause of hair fall. Then nutritional deficiency such as iron deficiency or micronutrient deficiency can lead to hair fall. Vitamin B12 and vitamin D also plays a role in if there is a deficiency, then it will lead to hair fall. Other causes can be androgenic alopecia, which is very common, which is androgen dependent hair fall, which happens with aging or as our androgen receptors are more, it becomes more, causes hair fall. So that is also one cause of hair fall. Then nutritional deficiency, definitely. Smoking can lead to hair fall. Obesity can lead to hair fall. Iron deficiency anemia can lead to hair fall. So every factor should be considered if it can be related to hair fall. Even dandruff, which is a very common cause for hair fall. All these factors should be ruled out, and then the treatment is given accordingly.
Right. So it's important to diagnose the cause. Unless the doctors could diagnose the cause, the treatment is not possible. And that's why it's important to go and consult a dermatologist rather than going for home remedies or over-the-counter treatments, etc. We'll talk about that as well in detail with you, doctor. But before that, as you said, many a times people are anemic, they have iron deficiency. But in many cases, because so much of information is floating these days, people are so aware. Now, what they do, if they are observing hair fall, they'll go to a chemist and ask for biotin supplement or iron supplement or zinc supplement and so on and so forth. So many gummies are there, these days. And they are not that pocket friendly as well. I'm sure with the amount of gummies one person is consuming, they can very well go and pay the consultation fee of a dermatologist and consult the right person. But anyways, the fact remains that people go for nutrient supplements, etc., without even consulting a doctor, without even knowing are they actually deficient on those nutrients or not. So, how would you like to address this situation? Is it okay to go for nutrient supplements by ourselves?
It's okay up to some level. I wouldn't say
Mhm.
that you can go beyond a certain range. If any micronutrient, if you're taking in your recommended daily allowance, which is their RDA requirement, then it's fine. But if you're going beyond it, then it might lead to toxicity. Some nutrients are water soluble, so it's fine to take them beyond a
Mhm.
certain limit. But if you are taking some fat soluble vitamins or something beyond the range, then you might get toxicity with that. But anything which is available in these gummies or these you can say nutraceuticals, then these
Mhm.
are in the range of nutraceuticals. They're never in the range of pharmaceuticals. So they are good to maintain it, but not treat the deficiency, I would say.
Mm. And as you very well said, that it's important to diagnose the cause. So we don't know what's the cause, or just by popping in these supplements is not going to help all by itself. So we
Right.
need to go and consult the right person, which is a qualified dermatologist in case you have anything to do with your skin, your scalp, etc. Now, as we are talking about, diet and nutrient supplements, etc., doctor, we would like to understand which nutrients, vitamins, or minerals are vital for our hair growth.
Starting, as everyone knows, biotin is everyone's favorite to consider.
Mhm.
Biotin
Yeah.
definitely will help in hair growth and the hair structure as well. Biotin is
Mhm.
very important for hair, but we cannot ignore other micronutrients as well, such as iron,
Mhm.
zinc, vitamin D, vitamin B12, niacin. These micronutrients also have a role in hair growth and hair structure improvement. So
Right.
all of these micronutrients should also be looked for. And going in very much in detail, if I talk about micronutrients, then zinc, selenium, magnesium, everything is required equally in the
Mhm.
dietary constitution.
Right. And that's why we often say or often get to read or hear that a balanced diet, a healthy diet is very, very important. Now, having said that, I would also like to, focus on the kinds of diet that are in these days, that are in trend these days, the fastings or various kinds of diets where one is allowed to have zero carb or eat for 8 hours and fast for 16 hours and so on and so forth. How do you take these diet plans or crash dieting, etc.? What's your take on that?
Crash diets are never healthy. So,
Mhm.
you can only crash diet for a particular event. That, might people do that, but that's not a healthy way to even lose weight, or it won't, take forward that weight loss program. So it won't help you ever. So I
Mhm.
think even for because your body memory is very good. If you are fasting more and starving yourself, then your body knows how to tackle that much of amount of food you're taking. So it will metabolize more slowly. जो normally आपका ज़्यादा होता है वो कम हो जाएगा because body will retain that thing, because
Right.
body will know that you're getting very less. So in long run it won't help you in the dieting factor also.
Right. Now, talking about the treatment options, what are the various treatment options available? We often hear that, there are medical ways, surgical ways, non-surgical ways as well. Please shed some light over those.
To start with, the prescription, or I would say the treatment for hair fall, will be divided in four conditions, like a topical medication, orally medication, what can be given, procedure non-surgically, which can be done, and the surgical
Mhm.
procedure. Starting from the topical one, the topical minoxidil, everyone knows about it. So yes, it does helps in hair growth, But there are conditions when to use it, how to use it, till what time, what should be the concentration, and how long it should be used. But for everything, we actually need to consult a dermatologist, because that was because dermatologists know when to stop it, when to start, what are the contraindications, and how it should be started. So one will be minoxidil. Other are Redensil is now a newer range of product which has emerged in market. Redensil, then there is Capexil and Procapil. Minoxidil also comes in combinations with finasteride, topical finasteride, and Aminexil. So these are the topical formulations which does help in hair growth. Orally, what finasteride and dutasteride is FDA approved. So these are taken orally. Now in market, oral minoxidil is also being researched on, but there are not many studies for that yet. And then these supplements, as I talked about, calcium pentathenate and biotin, these are also the oral treatment options for hair fall. Then coming on to non-surgical, there is one PRP therapy, or which is known as GFC therapy, or platelet-rich plasma therapy. This helps in hair growth. This is a non-surgical way of hair growth. And then there is low level light therapy. This is kind of a helmet or a comb. It comes in that form. There is very low energy of laser light used, diode light used to stimulate the hair growth. So these are the non-surgical ways. And coming to surgical ways, I think the only hair transplantation is the result. When there is a you say fourth or fifth grade of hair fall, then we go for hair transplant.
Right. You have very well explained the medical, surgical, and non-surgical ways of treatment. Now, the thing is, doctor, as we are continuously saying that we all shed hairs. Hair has their own cycle, and they do shed. But the problem is that whenever we see that something is not normal, I'm shedding more hairs than I used to usually, or I can see a lot of thinning of scalps, etc. I mean, this is a very common mentality. People doesn't go to the doctor at the very first place. They'll first try something from their kitchen or at their home, what we call dadi ka nuska, nani ka nuska, home remedies. Or we'll go to the chemist or ask for some over-the-counter products. Or we'll take suggestions from a friend or relative who had gone through the same phase. How good or bad these practices are?
If we talk about the practices, the most common is oiling. So oiling will actually not help with your hair fall, rather it will cause it more to happen. So hair fall should never be considered, oiling should never be considered for hair fall per se. It will only increase the circulation when you massage it. So I think if you can only, just massage your scalp without any oil, that will also make the same difference. And so as dandruff is also one cause of hair fall, so it also get increased when you are oiling your hair or oiling the scalp. So that will also increase hair fall later. So I think oiling will be the first thing we should eliminate.
Right. And then people, apply henna or mehendi or various other things. And do they work in case of hair fall or hair loss? Onion juice?
Onion juice is a very, is actually what onion juice is. Onion juice is like an irritant to the scalp. So it works on alopecia areata, which is not related to this hair fall, which is actually an autoimmune disease. There are patches of hair loss, which happens due to some autoimmune deficiency. Like it's an autoimmune disorder. So onion juice will irritate the skin there and cause stimulation of hair growth. But in case of alopecia areata, not in this regular hair fall which we have. So it will not help with hair.
Okay. And as these days, a lot of social media influencers are there, they are also endorsing a lot of products. And, we have hair products in the name of they are made, tailor-made for you, or you just give these specifications and they'll make these hair shampoos or conditioners, etc. People are actually spending a lot on these products for hair care. Is it worth to spend so much, or a basic hair care regimen can also be followed?
See, shampoos and conditioner has no role in hair fall or hair growth. So
Okay.
neither it will make your hair fall, neither it will make your hair grow. Shampoo has one sole purpose of cleaning your scalp. That's it. So it will not do anything else. Conditioner will only condition your hair shaft. And also conditioner is never applied on the scalp. It's only applied on the length. So it will
Right.
never be, it's not related to the hair fall. So these two things are actually claiming that this is for anti-hair fall shampoo. Nothing of such sort exists. So
Right.
obviously everyone should use their shampoos and conditioner in their budget, and this will not make any difference in hair
Mhm.
fall. The only thing shampoo can be chosen upon is how dry it's making your hair. Dryness is one thing which can, shampoos can change. Otherwise, nothing will happen to hair.
And many times, on hit and trial basis over years, we end up finding the right one for ourselves. Okay, we are okay with this shampoo, so we can go for it. You are saying because they doesn't play any significant role in hair falling or regrowth. Though many shampoos do claim so.
That is just
Now,
marketing gimmick, nothing else.
okay, right. So we know that now. And again, as we're talking about washing, a very common question that people often ask is that how often should we wash our hairs? Because हम जब भी नहाने जाते हैं बहुत सारे बाल गिरते हैं या कंडीशनिंग करते हैं तो और ज्यादा बाल गिरते हैं. So many viewers are there, they often ask that shall we wash our hairs once in 10 days or fortnightly, or what should be the pattern?
You can wash your hair daily also. It will
Mhm.
never harm your hair growth or anything like that. Nothing will happen to your hair. It's very
Mhm.
safe to wash your hair daily. But for like oily or the fine hair which are very oily, it's advisable to wash the hair daily. But if you have a drier scalp or dry hair, especially in the winter time, they
Mhm.
can give gap between them, and thrice a week is a good amount of hair washing for the drier types, because
Okay.
otherwise the natural oils will strip off if you are regularly washing your hair.
Right. And we would also like to talk about one problem which is very common in our society, and that's dandruff. And I'm wondering, because you just said that oiling doesn't help in hair growth. Does oiling help in dandruff or controlling
What? It will
dandruff?
just
Because again,
aggravate
people
it.
use a lot of oil, when they have faced this problem of dandruff. So what's the fact?
So actually dandruff is aggravated with oiling, because
Mhm.
what people say is there are just flakes all around. So they think it's because of dryness, and if they'll put
Mhm.
oil, it will subside down. But
Mhm.
actually it is fungal it's fungal in nature. So it will
Mhm.
be aggravated more if you're oiling your hair. So oil is
Right.
actually not recommended for dandruff prone scalp.
Okay. And why does it happen? And is it contagious?
No, it's not contagious.
Mhm. And why does it happen? Because it's very common, and people often, especially during winters, it's very common.
Yes, in winter there is, you can say, there is aggravation in seborrheic dermatitis, as we call it in our medical term. Dandruff is seborrheic dermatitis. Yes, there is
Mhm.
more scalp shedding is there. So there are two types of dandruff. If you've seen, there is a scaly kind of a dry flaky dandruff, and there is oily greasy dandruff, which
Right.
happens. It's like when we scratch, it comes in our nails. So, these are actually, it's fungal in nature, and it causes inflammation as well on the scalp. So it increases whenever the inflammation, whenever it increases, the more occurring of the flakes is there. So it's fungal, actually, it's kind of fungal infection.
Okay. And in case of dandruff, again, we need to go and consult a dermatologist so
Yes,
to get it treated.
because dandruff again is a cause of hair fall. So if you're having dandruff, then obviously you will face hair fall.
Okay.
So it
And
should be
what are
treated.
the treatment options? How do you treat dandruff?
Starting from basics, anti-dandruff shampoo should be used, a
Mhm.
medicated one, like
Mhm.
it should contain ketoconazole or cyclopyroxylamine or sulfonamide. That these should be the constituents of the anti-dandruff shampoos. And one, oiling should be avoided completely. Then now there are overnight leave-on lotions have come up in the market for anti-dandruff. This also works. Like the compound is similar, and
Mhm.
then sometimes you have to give urea based shampoos to remove the buildup of
Mhm.
the dandruff. Then there is salicylic acid, it can be used in the lotion form, or even the coal tar has been used for severe seborrheic dermatitis.
Okay. And doctor, nowadays nobody have virgin hairs. We have most of us have done something with our hairs. Now, dryers and straighteners are again an integral part of our day-to-day life. We use a lot of dryers or straighteners, colors, or so many salon-based treatments which use a lot of chemical is there. What's your take on that?
Again, obviously, all these procedures such as straightening or heat damage to your hair or color damage or bleaching, this does damage your hair shaft. The structure of hair is damaged because of that. But and eventually it will lead to hair breakage. But as it will not, hamper the hair growth because that happens from the follicle, and whatever we're doing is over the shaft. So there could be hair thinning. The hair thickness can be decreased due to it, but the hair growth or hair fall will not occur due to
Okay, okay. Right. And how to go for hair care? What are the basics of hair care? What to do on a daily basis or as a routine, doctor?
it. So never skip a conditioner after shampooing. It's must because it will detangle your hair, make it smooth, and at least reduce the breakage. That
Right.
will happen. Never oil your scalp overnight. Never keep it overnight. And always put oil on the length of your hair because the only effect it will put is the conditioning effect. So you should never, go through it like don't keep it overnight. That should not happen. Then never use very hot water shower for your hair. It should not be done. Avoid heat treatments such as straightening, perming, curling. That should be avoided. Even jahan tak ho paye, hair coloring should also be avoided because it will damage your hair eventually. Air
Uh,
dry your hair and just this deep condition it once in a week maybe. And
mhm.
if you have fine hair, then you should wash it regularly.
ओके। और जैसा कि आपने कहा कि जितनी कोशिश हो सके हेयर कलरिंग से भी बचना चाहिए बिकॉज़ अगेन दे हैव अ लॉट ऑफ केमिकल्स दीज़ कलर्स। नाउ माय क्वेश्चन टू यू इज़ anything to look for or anything to avoid when we go for hair coloring or we do it at home and while buying the products, can we take care of anything? Any particular chemical or anything?
Every hair color is actually a chemical, be it bleach free or non bleaching hair color, it doesn't happen. But if
Mhm.
someone is allergic to PPD, which is one compound in the hair color, which is it's not actually ammonia which will affect you. The more allergic one is PPD. So I think there are only two in market available, which is without PPD, as what I know about.
Right.
So for the home coloring, those should be opted for. And
Mhm.
for those patients who have allergic contact dermatitis, because once you have allergic to hair color, you will always be allergic to hair color.
Right.
So for those people, these compounds should be used.
Okay. Now, doctor, we all know that sun damages our skin, but does sun have any bad effects on our hairs as well?
Yes, it does. It makes a hair shaft dry,
Mhm.
and it will obviously make it dry and rough. That structure becomes rough in your sun.
Right. We can apply sunscreen to, safeguard our skin, what to apply on our hairs or how to
Cover
take
it
care
with a
of
hat
our.
or a cap. Physical barrier
Okay.
is the best way.
Physical, sun baths like scarves or hat, etc., they can be used. Okay, I'll quickly take few of the questions that our viewers have, sent. Dolly Saxena is here. Hi, I'm Dolly from Ghaziabad. I want to ask, does hair get thinner with age?
Yes, it does. It
Okay.
does as we age. In with our aging also, there will be receding of our hairline would be there. It's a sign of aging as well. So androgenetic alopecia, be it in males or females, it will happen. The
Mm-hmm.
pattern is different in males and females, but it does happen.
Right, so it's there. And again, in case of any trouble, Dolly, you can go and consult doctor because you're also from
Yes.
Ghaziabad. Right. And we have Prachi Mishra with us. Ma'am, I have so many pimples on my hair area and slowly it is spreading more. Any cure for it? I think
I
she
think
is
she's
having,
talking about forehead or the hairline.
yes,
So I
yes.
think the first should be oiling should be avoided, strictly avoided, no oiling. And the
Right.
other thing you should check for your dandruff because most common acne is it's hair, it's a fungal acne. And that can be controlled if you control your dandruff.
Okay, right. So again, Prachi, you need to correct few things that you are doing, and definitely you can go and consult a dermatologist. Do that. Now, as we are talking about care, and what all we do with our hairs, doctor, many times we see a lot of hair falling during winters or during monsoons. So, is there a connection with seasons and all? For me, like summers for me are best because I don't see a lot of hair falling on the floor. So, is there any connection with seasons?
Not actually seasonal, but yes, there are times of year when you shed hair more. Like there's different pattern in summer and humid weather. You have more frizziness, and there is more frizziness in your hair. Your hair becomes dry. So there
Mm-hmm.
is that is affected with seasonal changes. But you know how your hair fall works. There is a cycle on a telogen effluvium, which is there for approximately around 3 months. So whenever you come in that phase of your hair cycle, you will see more hair fall. And at one point of time, 15% of your hair are in digital fluvium. So that is actually cyclical. So yes, you can say it's approximately in that time phase for someone, and for someone some other time. But yeah,
Right.
there is.
Fair enough. Now, the thing is that, as we are continuously talking about the fact that hair is actually a mirror of what's going on inside us. Skin does the same, if something wrong with our skin, there are possibility that something is going on wrong inside us. The same goes for hair. Now, my question is, when we go for home remedies or over the counter medication, where we are not actually diagnosing the cause, are we actually missing out on some underlying medical condition in us? And thus it makes us even more important to go and consult a dermatologist?
See, I think iron deficiency in India is everyone is very prone to iron deficiency anemia, especially females in India. So,
Mhm.
yes, hair fall can actually be related to it. And if you are not getting yourself tested, you will never get to know about it. And there are other symptoms also for that, but that depends on a patient to patient. And
Mhm.
one such condition is thyroid. You know, when you actually a patient comes for hair fall and you get your the TSH levels done, and there is actually a thyroid disorder which comes. So that is how thyroid can also be diagnosed. Then other is vitamin D deficiency. There are many times patient when we get them tested for vitamin D and vitamin B12 for hair fall, then only we comes to know about that there is a deficiency. So yes, you missed on these conditions also.
Okay. Gitika Sharma is here asking, are there any complications with the hair transplantation as my aunt is thinking of getting it done?
Uh, See, if you are getting it done from a trained hair transplant surgeon or a dermatologist, then there is no harm in that, harm or side effect. There would be swelling, there would be pain. But obviously, uh, all is septic conditions are maintained and everything is done in a proper um, doctor-owned center, and in which a doctor is performing it. So always, see that who is performing that surgery, because nowadays in many places, technicians are doing these surgeries on the name of some doctor. So
Mhm.
everyone should actually know that who is performing the surgery, who is the trained doctor performing the surgery. So that will definitely help.
Right. And doctor, before we wind up the session, any take-home message for our viewers?
I think everyone should not treat themselves and should consult a dermatologist if you are undergoing any, symptom of hair fall or dandruff or any issue regarding that. Because eventually, if you just keep on popping gummies as if nothing would happen, and it will not help you. And the degree of alopecia which you're having now will increase with time. So treat on time. That,
So treating on time is really important. That's why I think initially when we said that don't waste your time in home remedies or OTT, over the counter medications, or taking suggestions from friends and families, because what happens normally we end up so much of time, energy, patience, and going for home remedies, etc., etc., that by the time we land up in front of a doctor, it's really late. I mean, so don't waste your time. All the time that you're wasting going for, influencers, etc. You can just Google the right person to go for. Just search for a qualified dermatologist nearby and go to them. Thank you so very much, doctors. It was wonderful talking to you. Thank you so very much.
Thank you.
And viewers, thank you for your active participation. And in case you want personal consultation from Dr. Akshita Anand, please, you can visit her Facebook, Instagram by the name Skin Fluence Clinic in Ghaziabad. Right, so a big thank you to all our viewers as well for watching the show. And for more information on how to get all your hair issues resolved, do like and subscribe to our YouTube channel, Hair All Issues Resolved.